Welcome back, everyone, to another episode of Mid-Chat Monday Healthcare Specialty Series. Today, we are going to discuss what it takes to become a cosmetic dentist. So if you're really enjoying these videos, please make sure to subscribe to the Mid-Chat Monday Facebook, YouTube channels to keep up to date with new interviews that are coming out. Today we have Dr. Jason Alster, who happens to be a very close friend of mine, who's a cosmetic dentist who practices in both New York and New Jersey. So Dr. Alster, welcome. I'm very happy, I should say, to have you to the show. So welcome aboard.
Thank you for having me. Very excited to be here with you.
So tell us a little bit about your background. What inspired you first and foremost to go into dentistry?
So growing up, I've always had a family influence in healthcare, being my dad's a dentist, my mom's a physical therapist, two uncles of mine are physicians, my aunt's a physician, my grandfather is a PhD in physical chemistry, not in healthcare, however, sciences. And so that's always been a big influence for me. And then throughout college, determining where I wanted to go, I shadowed a lot of physicians, surgeons, my dad, other dentists, and ultimately, all that led me to dentistry, using my hands, the artistry behind it, and all the planning and architecture that goes into designing people's cases and mouths and rehabilitation of their teeth and everything. So that's kind of what led me to pursue dentistry.
Now, I'm assuming that when you were a pre-medical student or pre-dental student, you essentially took the same classes that a pre-med student took to get into dental school.
Absolutely. So you take your standard year of biology, year of physics, year of chemistry, year of organic chemistry, and some schools require, biochemistry, and maybe one other sort of cell biology sort of class, depending on the school. But yeah, you take those same exact prerequisite courses before you go on to your professional studies.
So let me ask you a question. When you entered dental school, did you know that you were going to pursue a career in cosmetic dentistry? Or was that something that was an option on the table?
Yeah, so that was definitely an option on the table. I always like to tell people, I don't think anyone likes to say that they do ugly dentistry, everyone always tries to do things that look aesthetically pleasing, right? However, you have to be able to gear yourself towards learning different techniques to become more skilled in doing cosmetic dentistry, such as veneers and cosmetic bonding and implant restorations and all types of things that enhance someone's smile.
So how would you define cosmetic dentistry?
So cosmetic dentistry is, a aspect of dentistry that utilizes the most up-to-date technologies and newest techniques to beautify and make someone's smile more aesthetically pleasing, not only to the general public's eye, but more importantly to the patient's eye. They have to feel good about their smile and like what they see. So it may not be always what the doctor sees as beautiful or cosmetic, but what the patient likes. And you have to be able to please the patient and tailor your work to the patient's likes.
So it sounds like you started dental school, you were interested in cosmetic dentistry. What did you do your first 2 years in terms of making sure that your application, your CV, you were prepared essentially to go into that field?
Yeah, so I was always interested in cosmetic dentistry, being that's basically my dad's lifeline. That's what he does. However, through dental school, I kept a very open mind. I think it's really important. I think same for you. You'll probably say the same thing in medical school. There's so many different fields you can go into, and without exploring all those fields, you don't know what you necessarily want. You have to kind of take a little of everything and then kind of figure it out. So through dental school, it's very open. Towards the end of dental school, I'll say within between my third and fourth years, I was very keen on surgery. So I kind of took that route. And actually, it wasn't until after I started residency that I decided to change course a little bit and go into more of a general cosmetic direction.
So what was that inspiration that you had in your third and fourth year that made you think, maybe I'll do surgery, I won't focus purely on cosmetics?
Yeah, so I always love making people feel good. Making people feel good makes me feel good, and helping people. So with general dentistry, I have the opportunity to make someone feel good about themselves by giving them a beautiful smile, changing their appearance, while at the same time as doing general dentistry and cosmetic dentistry, I'm also able to help people that are hurting, people who have a lot of inflammation in their mouth or have infection or there's pain, and I'm able to also attend to those needs as well, not only doing the cosmetics, but also, more of a health thing. So in that sense, that's why I kind of changed from, a pure surgical standpoint to doing more general. And cosmetic dentistry, obviously.
If I may ask, how important is it to have a mentor when you're in dental school to give you perspective and direction? I'm assuming your father was certainly a role model, but were there other role models that you sought out?
Absolutely. So my father, again, was a big role model, and I think you have your father as well. They're big influences to us, but you definitely need that mediator, that person that's not family, to really be a really good mentor for me. And for me, it was actually one of my dad's very good friends from dental school who is like a god to me in dentistry. And he was really influential on me switching from surgery to doing cosmetic dentistry. And it's very important to have someone like that who can help you along the way in making those decisions.
Okay, so fast forward, you get into your fourth year. So dental school is 4 years, correct?
Yeah.
So you get into your fourth year, you apply for a surgical-oriented program, a residency program. What type of program was that, and how many years was that residency?
Yeah, so residency programs for dentistry range anywhere from 1 to 6 years. Some states require, some states don't require residency, so it depends on where you're going to practice, and it also depends not only where you're going to practice, but what kind of education level do you want after dentistry, So, like you said, I was gearing towards the surgical background. So I started, I had applied to oral surgery internship, which is basically a first year surgical resident program, where you're not matriculated into the full 4 to 6 year program. So I started that. And then I kind of realized that I wanted to go into more of a general dentistry route. So I switched and transferred to a full year after that of a general residency program that you do everything, right? So there are no other residents there other than the general dentistry residents. So you're doing surgery with the oral surgeons that are there. You're doing cosmetic dentistry with the cosmetic dentists that are there. You're doing root canals with the endodontists that are there. And you're getting a full experience. A little more
variety than the other program that you were originally in.
Yes, absolutely.
So are there different routes that one can take to go into the cosmetic dentistry world?
Yeah, I mean, during dental school, there's lots of different programs that you can, such as honors programs that you can, at least in my school, most schools do offer little concentrations in what you have interest in. So there was certainly an honors program, let's say, in cosmetic dentistry for a year, part-time. There was one in oral surgery, there's one in endo, there's peri, there's all these different concentrations you kind of do a little extra in. So I actually did oral medicine and oral pathology for a year there. Again, thinking I was going more of the surgical background, but so again, you can get involved with cosmetic dentistry right at the get-go, right in dental school, right away. And you can do it later on as well. There's the great thing about dentistry is doing general dentistry is there's so many continuing education programs, right? So, and they're not just like a 10-hour course that you can do and say, hey, I'm doing cosmetic dentistry and it's great. You can do year-long 2-year-long, 3-year-long, literally courses that are 1 or 2 days a week for that time period, and really get immersed in only doing cosmetic dentistry, or only doing, let's say, implant surgery and the prosthetics that go with it, or even root canal. There's lengthy courses. So you could start either in the beginning, or you can get into it later on. So there's lots of different routes you can take to get into something that interests you.
So tell us a little bit more about your training, your background when you did your residency. What were the hours like? How intense was it? What was the program like? Do you feel like you came out of that program more prepared, ready to be a cosmetic dentist?
Yeah, so the surgical internship is your typical surgery first-year intern. The hours are incredible. I don't know if you're familiar with what the term is called, black cloud, but I was considered the black cloud of the residents.
How would you define black cloud for the audience?
When you're on call, basically you're the one that always gets screwed. That you're up all night, and the other guys, when they're on call, for some reason they don't get paged. But that gives you a lot of experience. So I came out of that with a ton of experience. Now the general practice residency is a little more clinic intensive and less, outside those clinic hours. It's not as intensive. Programs you could be seeing anywhere from 7 to 15, maybe more patients a day in an 8-hour period or 9-hour period. There's usually a morning lecture, a lunch lecture, and then you'll be on call. The call schedule is a little more lax depending on the program. Some general residencies, the call schedule is Q3, which means every third night, and some it's every 14th night. It depends on how many residents are in that program. Then again, it also depends on the specialty. So in my program, my general practice residency, there were no other residents, so there was no oral surgery resident to take the oral surgery call for the attending physician. That was us, right? How
long was that program?
So a general residency is a full year, is 1 year.
But it sounds like your intern year prepared you for this more generalized residency program.
Absolutely.
It gave you an up against the other residents.
For me, it did. It's not the conventional way. The more conventional way is you go to your general practice residency first. That's more conventional. It turned out it was a huge help for me. Not only, I do a lot of cosmetic dentistry. I also do a lot of implant dentistry, and they go synergistically, right? So you always have to do surgery with the end point in mind when you're doing cosmetic surgery. Things for cosmetics. You always want to start with what you want it. You have to know what the end is going to be before you start. Otherwise, you have no idea where you're going to go.
Dr. Alster, is it important to do research in your residency years or even in dental school?
Yeah, I think dental school, and even before, I think it's really important to get involved with a research project or two at least. I was very fortunate. I was involved before I started school. I have 3 published papers before that. I hate to say I haven't really been involved too much since. I've just been too busy. You get really busy in residency, and a lot of times the residents, they get involved in research a little later on in their years. But in school, third and fourth year, you do have a little more time, let's say, to maybe get involved with a research project. And I think it really helps you, not only further your education, getting into a better program, let's say, but also being able to understand research and when you're reading it. You have to stay up to date with the latest and greatest, and that helps you understand articles that you read.
So you finished your training, your residency training. Did you apply for a fellowship?
Yes. So like I was saying with the continuing education courses, so after my residency, I ended up doing a 2-year implant prosthetic program that was 1 day a week for 2 years. So that was a really great program. I did that in implant surgery and prosthetics. And that really gave me a full didactic and clinical experience that I didn't have before in a particular field of a narrower field of dentistry of just doing implants and that's it, right? So that was a really great fellowship that I did afterwards, and you, like I said, I actually could have stayed on, done a third year. I didn't feel the third year was going to benefit me because of what it involved. It involved a little more complex surgeries that I didn't necessarily want to get into in my own practice. So that's the great thing again about dentistry is general dentistry and cosmetic dentistry is you can tailor what you want to do.
What do you love about dentistry? I mean, cosmetic dentistry in particular.
Yeah, I mean, working with my hands and I mean, literally sculpting people's teeth and designing teeth and the angles and the color and the shape to fit someone's face and smile is a lot of fun. You know, you get to go back and forth in pictures and wax mock-ups and now everything is done digitally, so we can do all this on a computer, and I could literally play around and show the patient what they're going to look like, and it's really fantastic. It's really a lot of fun.
Where do you think the field's going in the next 5 to 10 years? Are you excited about where the technology is going? Are you excited about the advancements, the research?
You there?
Yes, we lost you for a second.
Sorry.
Okay, so my question is, what are you excited about? Where, in terms of where the field is going in the next 5 to 10 years?
So I'm actually really excited. There's been a lot of great technologies that have come out on the market recently, and they're only going to be getting better from what I've been told. Such as doing digital dentistry. From surgery to cosmetics, everything can be planned digitally on the computer, a digital mock-up, and all of that can be translated through a 3D printer to print templates, temporaries of teeth, stents for surgery, to do guided cases. So technology is something that's really, really cool. I know it sounds a little lame, but it's really cool, and it's really exciting where dentistry is going, and also some new innovative research. A lot of dentistry is now becoming adhesive dentistry, and what that means is everything is geared towards bonded dentistry, like glue. So rather than old school dentistry where everything was more of a tight fitted, dentistry, the new research that's coming out is really exciting.
So when you finish your fellowship or your residency training, what are the options in terms of careers? Do you join a larger group? Is it possible to start your own cosmetic dentistry practice in this day and age?
Yeah, so you can definitely start your own practice. I think a lot of just like medical school, student debt, it's obviously a thing and it's out there. But it's not to get afraid of. It's still a great career to go into. It still can be very lucrative, and all that'll get paid back. Opening your own practice may be scary, but I have plenty of friends who are doing it. I'm very fortunate to have my dad, and we're going to grow from there. We're going to be we've kind of opened another location that we're going to be growing very soon, a lot faster, hopefully. I work in New York at a great office right now where we're also going to be growing as well. And there's a lot of opportunity for growth in dentistry. And the younger generation is really, I can see from my patients that they're excited about where the practices are going. I mean, I work in a very young, cool, hip office that is not your typical old guy dentist, drilling and filling. We do some really cool stuff here, so it's exciting, and I think everyone should be excited about where the career of dentistry is going.
Dr. Alster, what would you say to a first-year dental student who's interested in pursuing a career in cosmetic dentistry? What guidance would you give them, and what would you tell them to inspire them to go into dentistry?
So always be open-minded. You've just started your career essentially in dentistry, your education. You just started. You don't fully understand everything that's out there. So go into the perio department, go into the endo department, go into your aesthetic and cosmetic dentistry department and talk to them. Go into surgery, explore your different options. It doesn't take long for you to realize and narrow things down, right? So if you're excited about cosmetic and aesthetic dentistry, spend a lot of time with them. Maybe get into a research project. Shadow doctors. Find a mentor. Find older dental students who can show you what they're doing, now that they're a few years ahead of you later in their career. See if that's the way, the direction in which you want to go. So, always look to the future and look ahead and have those goals, but at the same time be open-minded about other things that, will cross your path.
Okay, well, Dr. Alster, I want to thank you so much for taking time out of your busy schedule. You have certainly inspired future cosmetic dentists and have given us the real insight into what the field looks like and what it takes to get there. So thank you so much for your time.
Thank you so much for having me. It was a lot of fun.